We're gathered here near the steps of the west steps of the Capitol here to announce a first of its kind coalition of California healthcare providers. These providers, this is an unprecedented, very broad-based coalition of California providers that is called We Care for California. It includes physicians, dentists, hospitals, first responders, healthcare workers, in-home caregivers, major health plans, labor and management. And as I said, this is really an unprecedented coalition of providers of healthcare in our state to make sure that the Affordable Care Act is implemented in a smart and sensible way. Every provider in California's healthcare delivery system really unequivocally agrees with the simple notion that more Californians need access to quality health care when and where they need it. But that quality care is going to be less available and less affordable in California if we continue to cut our system to the bone. We can't do that. And as such, we oppose the further rate cuts to California's Medicaid program, known as Medi-Cal, and we're here to talk to you a little bit about that as well. With that in mind, I'd like to introduce my friend, Senator Ricardo Lara, to talk about his bill, SB 640. Senator.
Thank you, Dr. Finney. It's great to be here. And like you said, it's a truly historic day to have such a unique coalition of various healthcare providers to take on a very important stand. I'm happy to join physicians, dentists, hospitals, health plans, healthcare workers, and caregivers from every corner of our community in support of SB 640. SB 640 ensures California's most vulnerable have access to care by repealing the 10% cut to Medi-Cal in the 2011-2012 budget. To fully realize the vision of Affordable Care Act, California is moving to expand its Medi-Cal coverage. Currently, Medi-Cal covers over 8 million Californians, 1 out of every 5 Californians. This number is expected to grow by as many as 2 million additional people by 2014. A critical component will be patient access to quality preventive care provided through Medi-Cal. However, patient access to care is hinged upon the availability of doctors and other providers. California pays Medi-Cal providers some of the lowest rates in the entire country. California is 47th in the nation for Medi-Cal physician rates. If these cuts happen, California will at once have the largest Medi-Cal enrollment population and the worst reimbursement rates in the nation. That's why we stand united today in an unprecedented way to ensure the success of the federal health care reform. California cannot continue to cut provider rates to the bone and also expect the same providers to take on more Medi-Cal patients than they did today. California's healthcare providers are ready to embrace healthcare reform, and us standing here together proves that. But our state needs to repair its broken safety net. If we do not ensure patients access, California's most vulnerable will find it nearly impossible to find a doctor. And the effects of the cuts are very real. Half of California's births are to mothers in Medi-Cal, approximately 250,000 per year. Every early access to prenatal care is critical, as we all know, and women who do not receive adequate prenatal care are 3 times more likely to have preterm birth. Each preterm birth costs the state $50,000 on average in medical and social service costs. What good is it to have coverage if a patient cannot get in to see a doctor? We want people to seek help before their lives depend on it. We want people to make routine checkups, not visit crowded emergency rooms. That is why my bill is supported by a broad coalition of over 40 groups, including patient and consumer groups like AARP and Children Now, providers across the board, including doctors, clinics, hospitals, physicians, and physician's assistants, as well as healthcare plans and insurers. SB 640 is critical for California's success in leading the nation as we embark upon full implementation of federal healthcare reform, especially for those that are most vulnerable. Thank you. It's great to be here, and I look forward to continuing to work to ensure that our most vulnerable continue to have access to care. Thank you.
Thank you, Senator. SB 640, a key piece of sensible and smart implementation of the Affordable Care Act. I'd next like to introduce Dave Reagan with SEIU. As I said, this coalition is broad-based: labor, dentists, doctors, hospitals, health plans. And Dave has some comments from the coalition as well. Dave?
Thank you. Thank you, and good morning, everybody. Our union, SEIU and SEIU United Healthcare Workers West, is the largest union of healthcare workers in California. We represent caregivers across the spectrum, and we are very pleased and proud to be here this morning, as was just said, as part of this historic and unprecedented coalition. On behalf of the members of our organization, we have somebody who is on the front lines as a caregiver, dealing with the people who are affected by these ill-advised and ill-proposed cuts in the current budget. And she, along with our member leaders up and down the state, are determined to pass this legislation to protect health care. So I'd like to introduce Michelle Ross, who's a member of SEIU UHW and a caregiver at Dignity Healthcare, which is the largest provider of Medi-Cal services in the state of California. So, Michelle.
Good morning, everyone. My name is Michelle Ross, and I am a patient registration clerk at Methodist Hospital in Sacramento. Working as a registrar in the emergency room, I am one of the first faces to greet patients as they arrive. These patients are sicker today than they have ever been. And you may ask why. Well, there is only one explanation. So many of them are without access to health coverage, and because of this, they put off getting medical attention for themselves and their loved ones until they are so sick or in so much pain or are so worried about one another that they can not wait any longer. This is not right. And I know that we can do better than this. This legislation will do right by so many. The single mother whose job doesn't provide health benefits. The father with a sick child who has lost his job. And the grandmother who can't afford her medications. But if that wasn't enough, without this funding, there are likely to be a lot of layoffs at my hospital and many others. Currently, we are actually suffering from this already. With that being said, who will care for our patients? Especially the millions more to come who will finally receive coverage under the Affordable Care Act. And who will care for our families when we, the healthcare workers, are without work? People who need healthcare will suffer, and we will lose more jobs just as we are coming out of a recession that has already been so difficult on so many others. Why on earth would we allow this to happen when we have the ability to stop it? There is nothing more important than our health, and we all know that. We all have suffered tragedies in our lives, with our families, and amongst our friends and co-workers. I see it personally every day at work. California has always been known as the land of opportunity, the land where dreams can come true. So I say let's fight to provide this funding to millions, to give them the opportunity to get healthy and to stay healthy. Let's make sure that everyone, no matter their background or their income level or where they live, can look forward to a California where we all have the health care that we need and where we can continue to make our dreams come true, to live long and healthy lives. Thank you.
Thank you, Michelle. You can't say it any better than that. Every doctor that I know knows that the person who first comes in contact with a patient at the window can make the difference between a bad outcome and a good outcome, between life and death, in fact. And I'm proud to have Michelle and her group as a part of our coalition. But if patients can't even get to that front window, can't get to the doctor in the first place, then they may have coverage, but they don't have access. SB 640 can help us change that, to make this better. It's not right, just like Michelle said. We need to make it better. SB 640 does that. I'd now like to introduce Sharon Spurgeon with the California Hospital Association for her comments. Sharon?
Good morning. I'm Sharon Spurgeon, and I'm the CEO Administrator for Coalinga Regional Medical Center. We have a 123-bed facility located in Fresno County, and 99 beds are skilled nursing. I represent Coalinga, but I also am here as a spokesperson for all of rural health. While we talk about health care, the reality is that we're talking about respecting the professionals that provide the highest levels of care in these communities. Skilled nursing facility cuts threaten patients and thousands of jobs of highly skilled service providers that care for them. For Coalinga Regional Medical Center, it would represent closure of a facility that has provided care for the community for 75 years and the loss of jobs for 246 skilled professionals. Without these resources, many small hospitals and emergency rooms in rural areas across California can't stay open. Residents would need to travel long distances and in very challenging conditions to access the Medi-Cal care that they need, the medical care that they need. The cuts represent a kind of patient dumping in a best case scenario. Worst case, the care people need would become extinct at the hand of government. It is difficult to imagine the impact of these cuts when preparing a spreadsheet and simply applying a formula across all DPNIF facilities. This process has had a devastating impact on residents as they continually question, do I get to stay in my home? SB 640 is the right thing to do as a society. It will stop the cuts, save the state money, and preserve essential services for patients who cannot go without medically necessary care and treatment. Please support AB 640. Thank you very much for your time.
Thank you, Sharon. I noticed that we were just joined on the platform here by my good friend, Dr. Richard Pan, who followed me a number of years ago as the youngest medical society president in the history of the Sacramento Valley Medical Association. I still can't get over that. He now serves us very well as a physician voice in the California legislature, and I'd like to invite him to make a couple of brief comments. Dr. Pan.
Thank you so much, Dr. Finney. First of all, I want to thank Senator Lara for his leadership in this issue. While I'm in the legislature and I chair the health committee, I also want to talk. I really want to talk about this as a physician, a pediatrician who spent most of my life taking care of kids on Medi-Cal. You know, the Medi-Cal system, unfortunately, has been one that has been chronically underfunded over time in terms of payments for various healthcare services. In where I practiced at UC Davis in pediatrics, we knew that we sort of counted on the rest of the health system to subsidize the care we're providing to the patient. That we run in the red taking care of our Medi-Cal patients, and that the university fortunately has been was willing to be sure that we still had the resources we need to try to take care of those patients. But as time went on, and even without the explicit cuts that were made, of course, with Medi-Cal rates being held, we saw a slow erosion in our ability to kind of deliver the kind of care we wanted to deliver. Because then what happened is that with the fact that we were not that the costs were higher, that we basically would reduce personnel who would be supporting the physicians taking care of the number of nurses or the clerical staff that was needed to do the kind of coordination of care, the outreach, the kind of care that we often talk about where we're trying to get to with the Affordable Care Act. And certainly this 10% cut now coming in with the fact that the state will probably try to not only reduce the payment now going forward, but also go back in time and grab that money as well. It is really going to, I think, is going to put people, a lot of clinics and a lot of healthcare providers, clinics, health facilities, others, on the tipping point, because you're not making money off of Medi-Cal, and so if you go back and you go, okay, now I got to find some way to scrape up this money, and does that mean I'm going to have fewer, basically have to have fewer nurses, clerks, etc. And I also point out that physicians, what we're seeing in the Medi-Cal system is basically, a lot of healthcare providers, they are trying to manage their finances by not taking on more Medi-Cal patients. When a hospital or a doctor or other healthcare professional takes care of a patient, we feel a responsibility toward them. And so Medi-Cal cuts its rates. We will find a way. We will find a way to take care of them and try to scrooge some money around in the practice or the clinic or something to take care of them. But when that hits a breaking point, because we don't want to dump our patients. We don't want to dump our patients out and say, we're not going to take care of you. Tell them we can't take care of you because the government, because someone has now created a cut and you're going to cost us even more money that we're not going to make back in the payments. We're going to find a way to take care of them. And that's what health professionals and health facilities have been doing for so many years. But this is a potential tipping point as we now have to scrape money, and we don't want to do that to our patients. And so people are going to find a way, and but what you see is that we're going to now try to add 1 million new people on the Medi-Cal system. And those people will be better off for being in Medi-Cal for all the problems we have in Medi-Cal. And that's why I strongly support the Medi-Cal expansion. But we're really going to get the maximum out of the Medi-Cal expansion and the Affordable Care Act as we try to get everyone under coverage. Be sure we can actually manage the care that they're getting. We do need to be sure that the people who are taking care of them have the resources to be able to do the kind of coordination of care, to be able to integrate the care, to bring down the cost curve that we're going to want to see happen so we can keep our costs under control, that people get high quality care. And so we can't just have people living barely on the edge, because that doesn't give you the opportunity to do that. And that's why it's so important that Senator Lara has taken this leadership and saying, well, let's be sure we're in the right place as we're moving into the Affordable Care Act, as we get more people in the Medi-Cal. Be sure the patients who are on Medi-Cal are able to get the kind of quality care they need. And certainly I think most people who are on the front line seeing patients know how important this is. And so I'm glad to be here, not just a legislator, but as a frontline clinician who's still seeing Medi-Cal patients right now. That I know how important this is. And again, I want to thank the folks here for your support. Thank you. Senator Lara, thank you.
Thank you, Dr. Pan. Well, thank you all for coming. Do we have one more? We have one more person, part of the coalition, that would like to come up and speak. I didn't know this, so we're on impromptu here. But I think this gives you some idea of the breadth and the strength of this coalition. Unprecedented and very strong, working towards smart and sensible implementation of the Affordable Care Act in our state. So, welcome.
Thank you very much. Good afternoon. Assemblywoman Holly Mitchell, 54th Assembly District in Los Angeles, Chair of Budget Sub 1 on Health and Human Services. Proud to be up here in a bipartisan effort to talk about critical health services to the state of California. Due to the state's dire fiscal situation over the last decade and economic downturn, we've had to make a lot of very painful decisions over the past few years and cut valuable safety net programs and services that Californians rely on for their basic needs. I'm here to tell you no one understands that better than myself and the members of Budget Sub 1 we've had to sit through hundreds, conservatively speaking, hundreds of hours of testimony, just my 3 years now as budget chair. Grappling over these very, very tough decisions. Tough because we fundamentally understood that we were making life and death decisions, quite frankly. We understood that. The AB 97 cuts enacted through the 11-12 budget have negatively impacted all Medi-Cal providers as well as beneficiaries, especially a distinct part with regard to the nursing facilities, such as the Jewish Home of LA, Motion Picture and Television Fund Home, a number in my district who've come forward on a regular basis to talk about how they are struggling with these cuts. So I'm pleased to join with my colleague as co-author, thank you for allowing me, sir, of SB 640 to really talk about in this time where the state has taken a turn for the positive. We've heard from the LAO. All of you did your due diligence as Californians and paid your taxes April 15th, and so we see a surplus in the budget. Now is the time to talk about appropriate investments in California's core infrastructure. As we talk every day in Health Committee and Budget Sub 1 about the incredible opportunity we have as policymakers to expand access to care to all of Californians, particularly those who have historically not had access to health insurance through the Affordable Care Act, we've got to make sure that the core foundation upon which we expect to build upon is solid, and making sure that those who have contracted with the Medi-Cal program, our Medi-Cal providers across the state of California, are in a solid, healthy position to be able to receive the newly expanded Medi-Cal program and all of the Californians who will now be able to access preventive health care services. So turning back the clock on this 10% cut for medical professionals across the board is a critical first step in terms of in California investing in our future, investing in a core infrastructure that will keep California healthy and thriving. With that, I'll turn it over to my colleague, Assemblymember Manshine.
Well, thank you very much, Assemblymember Mitchell. It is a big honor to come over here today to help support. Certainly, I've had the good opportunity to work with Ms. Mitchell on a number of issues, so this is another one we're having an opportunity to get people talking. And I think this is something that's critically important to the districts that we represent. We're talking about cuts that have had a disproportionate impact, I think, on certain populations as well. And whether it's chronic medical conditions, whether it's mental health issues, whether it's emergency type care, all of these, I think, have a critical import to the people that we're up here to represent. So I think this is a good day for certainly for my district. I think it's a good day for our region. It's nice to see the collaboration. Certainly all the public safety and public servants that are up here today, it's nice to be able to support them as well. And I want to thank my colleagues and the Senator as well for pushing this forward. This is something that will ultimately have a great benefit across all the districts within the state, and it's certainly across all the populations that we have the good opportunity to be up here and represent. So thank you very much for inviting me to be a part of this today.
Thank you very much, Assemblywoman. Unexpected surprise, and just demonstrates the level of commitment to this effort. The coalition, We Care for California, with its physicians, dentists, hospitals, first responders, health workers, caregivers, health plans, labor and management, and the strong support you see in the legislature here in California to stop these cuts and help to assure the smart and sensible implementation of the Affordable Care Act in our state. With that, I think we're done with our comments, and I'd like to invite any questions here with the open mic, or I'm sure that the members of the coalition and the Assembly people and senators will be willing to stick around for comments as well. So with that, are there any questions? Okay, thank you very much for being here and showing your commitment to this effort.